Welcome. My name is Jason Brodsky, and I'm joined by my colleague, Andy Jordan. Thank you for tuning in. On behalf of the Division of National Practitioner Databank, we are delighted to have the opportunity to present information to you about the Federal Tort Claims Act and the National Practitioner Databank, working together to support quality care and patient safety. Our presentation will describe the mission of the National Practitioner Databank, FTCA deeming requirements involving the use of the NPDB, use of agents, our Attestation Initiative, and where you can find additional resources. Next slide, please. The National Practitioner Databank was established in 1986 out of a concern that healthcare entities needed more information to make informed hiring, licensing, and credentialing of healthcare practitioners. At the time, if a practitioner did something wrong, he or she just would pick up and move to another state. And there was no way for a future employee or state medical board to find out about the previous situation. Congress created the National Practitioner Databank to be a workforce tool. It is a central place where information on practitioners is stored and can be accessed by healthcare organizations making hiring and credentialing decisions. Next slide, please.
Thank you, Jason, for that introduction. The reason we're here today is to emphasize the links between the FTCA program and the NPDB. The Health Center program and FTCA requirements are similar regarding credentialing and privileging. It's both Health Center program policy as well as FTCA program deeming that require querying the NPDB. This requirement can be found in the HCP Compliance Manual, Chapter 5, and in the annual FTCA deeming application. Here you can see excerpts from the deeming application, which is a document that's on the slide. Next slide, please.
When you are considering hiring or credentialing a clinician, you would want to know what kind of information, if any, has been reported to the NPDB. We call that querying. When you query the NPDB, there is a lot of information available to your organization. To get an idea about how valuable the NPDB is as a workforce tool, here you see some numbers. The NPDB contains more than 1.3 million reports. Every month, the NPDB is queried more than 640,000 times by healthcare entities across the country. On average, state agencies, malpractice payers, and healthcare entities submit more than 7,800 reports every month. And there are more than 670,000 practitioners and more than 24,000 organizations represented among the reports in the National Practitioner Databank. On this slide, it shows the kind of reports that are contained in the NPDB: adverse action reports, medical malpractice payment reports, and judgments or conviction reports. Next slide, please.
As noted earlier, health centers are required to query the NPDB. So it's not just the NPDB legislative requirements that are important to you. Health centers have to have credentialing and privileging processes in place for initial hires and subsequent biannual reviews. This process includes the requirement to complete a query through the NPDB. This is an excerpt from the compliance manual, and there's a link to the specific chapter. Also note you can query on a wide range of practitioners that are called licensed independent practitioners or other licensed and certified practitioners here. We have 17 specific professions and others that are included in our reports on the HRSA data warehouse to give you an idea of the kinds of professions that are included. Almost anything you can think of, a wide range of behavioral health, as well as pretty much optometrists and almost anything else you can think of. So there's a lot of information there. Next slide, please. While querying is required in specific circumstances by the health center program, health centers may query for all of the following reasons: when they have or may be entering into an employment or affiliation relationship with a healthcare practitioner, when practitioners apply for clinical privileges or medical staff appointments, when they are engaging in professional review activity with a practitioner, or when a practitioner asks for expanded or additional privileges, when a health center is credentialing a practitioner or renewing a practitioner's credentials. So all of those are times that you can do querying. When a health center queries the NPDB, it will get a lot of information: medical malpractice payment information, licensure actions by states, adverse actions taken against clinical privileges by other entities, and a lot more. But it's also important to note that you may not get any information. 95% of queries receive no reports found response, and that's good news. But this information is also beneficial in your decision-making process. As most of you know, querying is not free. It costs your organization $2. Self-queries by practitioners, which is when they ask for a copy of their reports on them, which they then provide to potential employers, costs $4. It's important to note that self-querying is not allowed under the health center policy. The entity must do the querying, not the practitioner. Next slide, please.
So how do I query? There are two ways to query the National Practitioner Databank. There is a continuous query for which you can enroll practitioners and receive information that the National Practitioner Databank may receive on them during the one-year enrollment period. You can also do what's called a one-time query, in which you submit a request for an individual practitioner and receive only what's available on that person at that time. The fee is the same, $2. Next slide, please.
Great. That takes care of querying responsibilities for health centers. Now I want to talk about reporting. This slide includes the key language from the NPDB regulations and language from our website regarding reporting. If you meet the definition as an entity that engages in professional review activity, you are required to report certain actions taken against physicians and dentists. These are clinical privileging actions that last more than 30 days. The key reason for reporting, other than the legal requirements, is that without reports, querying is not very effective. If nothing's in the data bank, you can't get anything out of it when you query it. In addition, the FTCA manual is a good resource as well. Section 2, Part 1 on malpractice payments and immunity, and Part M on the medical claims review panel role in reviewing payments both reference reporting to the NPDB. So it is important for health centers to report. Here's some additional statistics on the kinds of reports that are in the NPDB. State licensure reports make up 55% of all the reports in the data bank. Malpractice payments, 29%. Exclusions and debarments, 8%. Judgments and convictions, government administrative actions, clinical privileges actions, 2%. Health plans, 1%. And minimum amounts of DEA or federal licensure reports, professional society actions, or accreditation. That tells you a little bit about what's in the data bank, so the kind of thing you will find. Next slide, please.
So why is reporting important to health centers and their patients? As Andy mentioned before, querying is only as good as the quality and quantity of reports submitted. Since providers often move to other similar settings or practices, reporting by one health center can protect other health centers and their patients. Next slide, please.
So it should be reported by health centers. As mentioned earlier, physicians and dentists must be reported for professional review actions that impact clinical privileges for more than 30 days. Next slide, please. Also, reporting should be done for cases where a practitioner surrenders their privileges while under investigation. If you've initiated investigation on someone and they say, okay, never mind, I'm just going to leave, that needs to be reported. That's very important information to include as well. Next slide, please. Reporting of other professionals beyond physicians and dentists is not required, but is strongly encouraged. Health centers and other entities employ a wide variety of professionals, and the more information you can get on people when you're looking to hire them is important. So you can also report on those professionals as well. Next slide, please.
Many organizations use agents for querying and or reporting. It's important to note that agents must be registered as well. Even if the agent is doing the reporting and querying, to receive information on queries. Next slide, please.
Now we want to review the role of attestation for health centers. Attestation is a process that has become part of the registration renewal process that takes place every 2 years. So every 2 years, you'll be asked about the attestation program. So I'm going to give you a little bit of information about it. It has two goals: to ensure the accuracy and completeness of the information in the NPDB and to help educate users about their reporting obligations. Most entities very only occasionally report. Health centers in general have very few reports in the data bank. So it's difficult to remember all the ins and outs of reporting and what's required. Attestation is an opportunity for entities to look at their reporting requirements and make sure they understand what they are and whether they're meeting them. The benefits of querying are only as good as the quality information available from reports, so complete reporting is critical. For some background, in 2010, the NPDB began a compliance process with state boards, which included attestation. It was very successful in increasing the number of reports that were submitted that were required and hadn't been submitted previously, and bringing the boards into compliance with their reporting. So we've expanded the Attestation Initiative to all entities now currently registered with the data bank. Health centers and hospitals were the next two organizations that were rolled out, but now everyone is part of the attestation process. Next slide, please. What is attestation? As I said, it's a compliance initiative to assure the most complete data on healthcare practitioners and entities are available for querying. And we basically ask you, when you're registering and renewing your registration, to assert that you've reported all the things that you were required to report during that previous 2-year period. At the same time, health centers will get a listing of sites that are included within their scope of projects. We want to make sure that all of the organizations that are involved in your credentialing and privileging process are included in our information. We have about probably 95% of them are accurate. Occasionally people add a site or delete one because there's delays in the EHB information that we get. So you'll get that as well in the attestation process. Next slide, please.
There are a lot of resources available that explain the attestation process and purpose in more detail. The NPDB website, pictured here, has a wealth of information. The red circle on the bottom is a link to your organization, where you can select health centers and see right where the red arrow is showing you. That will direct you to the specific health center attestation page. Next slide, please. So where can you get more information? Well, the BIPIC has resources on risk management, and NPDB has a number of resources on querying and reporting. Next slide, please. Here are some NPDB resources. If you have specific questions, please contact our customer service center. The hours of the customer service center are Monday through Thursday, 8:30 a.m. to 6 p.m. and Friday, 8:30 a.m. to 5:30 p.m. You may also, at any time, of course, send an email to the address listed here. We are also encouraging all of our organizations to complete our survey so we can assess the characteristics of and generate comprehensive knowledge about users of the National Practitioner Data Bank. This will help us improve our processes and systems. The survey will be open between May and June of 2021. A link will be sent to users via email or secure message. Your feedback is essential to improving NPDB as we seek to improve healthcare quality. Next slide, please. I'd like to take a moment to remind everybody of some important dates. On April 19th at midnight, the EHB system will be closed to transition to the new FTCA applications. On April 23rd, EHB opens to accept health center redeeming and initial applications. VHP redeeming and initial applications can be submitted with the health center annual redeeming application. June 25th is when health center redeeming applications are due. And on July 15th, EHB will begin accepting VHP supplemental applications. Next slide, please. We encourage everybody to connect with HRSA. at www.hrsa.gov, where you can sign up to receive our e-news and of course follow us on social media. This concludes our presentation, and I want to thank you for attending this session on the National Practitioner Data Bank. And we look forward to working closely with health centers and lookalikes in the coming years.